It is quite important that we all know how to use the PPE, how to put it on, how to take it off, as well as what not to do when we have PPE. So PPE by definition is personal protective equipment. And today's video will be based on the PPE that is recommended for coronavirus protection for healthcare workers. As you know, at the moment, the CDC and the WHO recommend droplet precautions, which is different from aerosol precautions. So today, for droplet precautions, we're talking about coming into surfaces or coming into contact with somebody who's suspected to have COVID-19. When we're talking about PPE for aerosol generating procedures, we're talking about things like surgical procedures as well as intubation. And the PPE that has to be done for those procedures is completely different. Before we actually go into the PPE, I'd like to explain the difference between the masks that we have been using. At the moment, you will see two different types of masks being used a lot. This one here is a surgical mask. With this mask, it has a one-way filter. So this mask is best used when you are around or in contact with somebody who has a cough. The mask actually prevents the wearer from spreading an infection. So if you have a cough or if you're afraid of spreading the infection, this is the kind of mask that the wearer that should be worn, as opposed to this one, which is also called a respirator. This one has a two-way filter. It prevents you from giving out an infection, as well as it filters particles coming in so that you do not catch an infection. So this is the one that is recommended for use by healthcare workers to protect ourselves. At the moment, according to the CDC guidelines, the basic PPE required for taking care of suspected COVID cases or known COVID cases for healthcare workers is a gown, an N95 mask, goggles, and gloves. It doesn't have to be a sterile gown. So we're going to go through the steps of how to actually put it on. And the steps are, first you put on the gown, secondly is the mask, the goggles, and then gloves last. Prior to donning the PPE, you have to perform hand hygiene for about 20 to 30 seconds. In this one, I have hand sanitizer. And remember, when you're sanitizing, to also remember to sanitize the fingertips. So you rub them as well as this way, in between, over, interlock, and rub again, right? Most people usually take hand sanitizer and just rub it together like this, which is not the proper way, because anytime people touch their faces, they don't touch their faces using their palms. It's usually with the fingertips. So the hand hygiene has to focus on the fingertips as well. Now that we've performed hand hygiene, the next step is to don the gown. It is important to be covered fully from the torso to around the ankles. When placing the gown on, it's important to always tie the straps as recommended. This is to avoid it flying all over the place later on during use. So the straps, when doing the top, you avoid touching your body. Up next, we're going to put on the mask. The important thing to note with this mask is that it has this metal piece up top here. This always goes to the top above the bridge of the nose because you're going to use it to mold. In an ideal situation, before using this mask, you have to be fitted for it, as well as perform a fit test to make sure that you are medically fit to wear it for at least 8 hours. Unfortunately, we don't have that capacity at this time. So again, the mask. Using both hands, you compress over the nose to form a tight fit around your face. Use both hands at the same time. Prior to continue, you can do a mask check. Put your hands on your sides or over your face and exhale. If you feel any air escape, readjust your mask again. All right, so this one is fit. Once it's on, it has to remain on throughout the entire time. Next is to put on your safety goggles. Remember, eyeglasses do not substitute as safety goggles. The gloves in. Remember to put the gloves over your gown so that there is no gap between the gown and the gloves. So now that we're fully donned in PPE, remember when coming in contact with patients, avoid touching your face, avoid touching the back of your gown, avoid adjusting the straps on the back of the gown. If for whatever reason during your procedures, your hands get soiled or your gloves get soiled, go ahead and remove the gloves. Perform hand hygiene prior to replacing the gloves. Avoid touching the front of the mask, adjusting the mask, moving the mask on your forehead or on your neck. Once it is on, it has to stay on for the entire duration of patient interactions. Now we will go through the steps of doffing the equipment, which means to take it off. The sequence starts with the gloves, the goggles or face shield, the gown, and the mask is last. When removing the gloves, use one hand to pinch the middle part of the glove and swiftly remove it. Without touching this other glove. Hold the used glove in one hand. You can use your index finger to slide it under this one. Again, you're not touching the outside of the glove. And you roll it over. At any point, we didn't come into contact with the outside of the glove. You go ahead and discard it. So next is for the goggles or the face shield to come off. Thereafter, you remove the gown. When removing the gown, do not let your arms come in contact with your body. Reach over to the straps of the gown and untie the straps. You reach over again, taking close care not to come in contact with the rest of your body, and you undo the straps from the back. Reach over again to the back to gently bring the gown to the front, taking great care not to touch the front of the gown. Your hands can go inside. As you remove it, you turn it inside out. Hands go inside again, and you turn it inside out. Now the gown is inside out, and you can nicely ball it. Again, discard. Taking great care again, do not touch the front of the mask. Again, remember to perform hand hygiene for another 20 to 30 seconds prior to proceeding. Thank you.